Depression is a common medical problem that's seen in adolescents and young adults. Estimates are that close to a third of adolescents and young adults have depressive symptoms, and approximately 25% of young adults and adolescents engage in self-injurious behaviors like cutting. And suicide is the third leading cause of death in adolescents and young adults, so it's a serious concern. Some of the signs and symptoms of depression are if someone changes their behaviors significantly. So in a teenager, if all of a sudden they stop hanging around with the friends that they usually hang around with and isolate themselves, if their grades start to fall significantly, if they normally like to play sports or engage in activities like art or theater and all of a sudden they decide they don't like doing those things anymore, those are concerning behaviors. If they appear sad, at least for 2 weeks, that's the general definition, or longer, those are concerns. If their sleep patterns change, if their appetite changes, if they start to engage in any kind of self-injurious behavior like cutting or burning, if you notice blood on their sheets, those are concerning signs and symptoms. And then most concerning is if they voice thoughts of wanting to die or hurt themselves or kill themselves. If you have any weapons in your home, you would need to make sure those are secured or removed so there's no access to suicide completion, which is the most common form through gunshot wound for adolescents. So those are concerning signs and symptoms, and if you see those behaviors in your teenager or young adult, you need to contact your primary care physician and get a referral for a psychiatric evaluation with a psychiatrist that specializes in that age group, and or seek a counselor to get them other types of treatment like psychological counseling.